Next, from the state capitol, as the state's central management system looks to save money on healthcare costs, we talk with an expert on Medicare who says CMS is proposing coverage that will cost more while offering fewer health benefits to retirees. He says the cost difference means the state could spend over $100 million more than necessary. This runs about 10 minutes.
Frank Bryant, thanks for joining us on the Illinois channel. You're with Insuraprise, which is out of Texas, but you're going to be testifying on before the Senate Executive Committee this afternoon as we tape this on Senate Bill 1515, which, first of all, tell us in your words, what would that bill do and why do you object to it?
Well, I object to it primarily because
So let's first, what would it do before we...
Well, one of the things that, from my understanding, that would do is would give CMS the authority to purchase whatever solution it wants and go whatever direction it wants without any oversight from any of the committees that would be involved otherwise. So basically, whatever option CMS chooses for its retirees, everyone would just have to live with it.
And what we're talking about is the health care coverage plans that they can select.
That is correct.
All right, there's a couple of terms that the average person isn't going to be familiar with. And I will tell people, just to summarize where we're going with this, the gist of it is you would be saying that what CMS is going to select for the employees, CMS being the Central Management Services, it's a government agency here, that they would basically have the employees forced to select a program that you would argue, A, costs more money, and B, offers benefits that are not as good as they might otherwise be able to get for less money.
That's exactly right. That is
And in essence, I think the cost to the state as well would be what, somewhere in the area of maybe $200 million higher than it otherwise could be?
Actually, it'd be more like 100 to 150 million higher than it would otherwise be. But what they're talking about doing is signing up with a one-size-fits-all Medicare Advantage plan. In the terminology for the state, it'd be a Medicare Advantage group waiver program. Basically, they're going to take the existing Medicare rights that everyone's already paid for and is currently paying for, and they're going to privatize them and put them into the Advantage Plan program. What they could be doing, what we advocate for, and we're trying to get the state to see it our way, is go with a Medicare supplement plan that doesn't affect or doesn't alter or change their basic Medicare rights, and then fills in the remaining portions that Medicare leaves you responsible for, thereby eliminating all of their out-of-pocket co-pays, deductibles, without any networks to fit into or anything like that. By going that route, the state will save at least $200 million per year.
Now, people would say if it's that obvious that these programs are better and they cost less, why would CMS be selecting something that costs more and offers less benefits?
You got me on that one. I have no idea.
Have you talked with CMS? Or?
We've had conversations with some people in CMS. We've also attended some of the hearings where they spoke on this, especially namely the COGFA hearing, which was asking why on earth do you want to cut us out of the oversight. But when it comes down to it, I can't see any real benefit of privatizing everyone's Medicare. And even if it's the key word that they're using is comparable benefits to what they currently have, because the state retirees have really good benefits, but they can get better benefits for less. So
for an individual recipient, is there a way to draw a comparison? I mean, on average it would cost this versus that?
Yes. On average, according to the numbers that we've been able to pull from the last 12 months of sales from all our clients in Illinois, you're looking at around $150 to $160 per month for an F plan, depending on your age and area, of course, and that is an average. And then national average for a drug plan is about $35. So altogether, you're around just under $200 per head, whereas CMS's option, the Advantage plan, you were looking at about $360 per head for less benefits.
Have you met with any of the state unions and tried to just go over this with them, and so that they might be on your side?
Yes. We've had really good conversations with ASME. They've been receptive. Their primary goal, which is rightly should be their primary goal, is to watch out for all their union members. They just don't want to lose benefits. So, and that's what we don't want either. We don't want anyone to get anything less than what they deserve, which is in our mind, 100% coverage everywhere in the nation.
Now, tell us a little bit about Insuraprise, and do you guys stand to gain if people go and select the plans that you would argue are better?
Well, we're an enrollment portal for the city at this point. I'm sorry, for the state at this point. What we're trying to do is get the availability for people to choose from any of the plans that are out there. Or if the state determines, the state can set up what plans they want on the portal. We don't charge for our service to the individual person. So it's not as if each person out there is going to have to pay a fee to use the site or anything like that. What we're looking at is just a simple side-by-side comparison of identical plans. If someone goes with an F plan, it's always an F plan. They're standardized throughout the United States. It'll work anywhere in the United States. What you're looking at that point is the cost to insure that individual under the same identical plan. So, for instance, Mutual of Omaha might be $30 more for that person than an Aetna product or an AARP product. And that's what we specialize in, is we're able to distill all that information and come up and show everything right there so you can choose intelligently.
And are there some critical benefits that would be available under the plans that the Medigap plans as compared to what CMS is pushing?
Well, one of the biggest things would be provider access. Currently, if you're looking at specialists, 96% of specialists in the United States take Medicare. And that's the only requirement you have to have when you're speaking to a doctor or going to a hospital. Do they take Medicare? At that point, everything with a supplement is automated. With what they're trying to do on the Advantage plans, that's a private network at that point. So it's either going to be a PPO or an HMO option. So you might lose your doctor. You know, you might not be able to go to the specialist that helped out your sister or your brother or your father so well so many years ago. There's a big problem with that. Plus, the networks are all ever changing, as are the coverage levels on the Advantage plans. So what you get today might not necessarily be what you're going to have in 2 or 3 years.
Now, age-wise, what is there age brackets here that these plans apply to, or do you have to be over 65, or what is it?
For a Medicare supplement, you just have to be Medicare eligible. That's it.
And that age is?
Well, in the state of Illinois in particular, you guys can, as long as you've worked 10 years or 40 quarters, you can get your Part A at no cost, and your Part B will just be the monthly fee currently of $104.90.
Is that a problem? I mean, in that you might have some employees that wouldn't qualify for these plans?
No, if they qualify for Medicare, they will be a guaranteed issue right to select one.
But I mean, and again, these terminologies, CMS is pushing, what is the term there?
A Medicare Advantage plan.
Medicare Advantage. Would Medicare Advantage apply to 100% of the state's employees, or the Medigap would only apply to some?
No. They both have the same enrollment requirement, which is you have to qualify for Medicare.
The Illinois Channel's coverage of legislative issues is underwritten in part by AARP Illinois.